I was born with what is called arthrogryposis. It is basically a permanent rigidity of the joints. It can affect one limb or all limbs or all trunk muscles. I have the more profound one, although I am not as drawn up and, dare I say, contorted or deformed as some. Also, I'm not as lucky as others that have just barely the wrist. Lots of things are not as easy. Taking a shower, just going out to the store, or fixing a meal, or getting something out of the refrigerator. I mean, if the pedals or leg rests, excuse me, are on this chair, I have no access to my refrigerator. I have no access to much of anything because I can't move forward like I used to be able to. That's one of the things that I also think is really sad about the process of this Who Won the Bid. It doesn't allow you to go to a company that you're familiar with or that are familiar with you. We may have standard equipment, but we do not have standard disabilities. They are very wide in variety, and the needs of each person is going to be extremely drastic sometimes and extremely just a little bit. And a standard wheelchair just does not fit every person with a disability or any other kind of equipment. I use a CPAP with a mask. That's another whole nother scenario. You know, for someone who can't reach up to their face, whole different ball game. You know, had to go through lots of different equipment. But I went through the process step by step at the beginning of the year as to how to find out your providers and what category to provide them in. You're limited to less than a dozen, half a dozen, and 3/4 of the time they either say they got it and they don't, or they say, no, we don't have anything, we can't help you. And the organizations or groups, businesses that I've gone to in the past can't do it because they didn't win the bidding war. And, you know, and I did the process mainly because I wanted to learn how to do it to instruct our other individuals, because this was a new change at the beginning of January. Well, it hasn't helped for me to learn how to do it because it's complicated for me, and I'm pretty tenacious. I can pretty much stick to things. But this has been more frustrating than I care to even want to deal with. I am getting ready to purchase some more equipment and not exactly sure where to go because I can't go to the standard place that I would typically go because of the Medicare Who's Won the Bid. Now, whether or not, and a lot of times people have to receive equipment sight unseen. Well, this is what it looks like in the book. That doesn't do a person any good if they have lots of different types of limitations. Well, first they'd say, oh, sure, we can help you. Just tell us a little bit about your situation. And after I would get into the situation a little bit, about, oh, no, I don't think there's anything we can do. We only service in this brand, or we only have these types of scooters and wheelchairs. And it took an act of Congress for me to find a four-wheel drive wheelchair. The biggest thing that I think I'm really upset about this whole thing, and not on a personal level, but on a global level, we have 6,000 individuals. We practice trying to give choice and quality of life to individuals. They've just taken our choice away by limiting us to specific providers within our zip code, and these 6 providers could cover, you know, several counties and cross the state line. It's not by your zip code, it's by the whole doggone area, because you get the same one no matter how many 10 different zip codes you put in. But it has made me less independent, and that's kind of frustrating. And I can't imagine how frustrating it is for individuals with lower cognitive abilities. We support individuals with intellectual and developmental disabilities throughout the 8 counties, and whether they had an intellectual disability or were just raised in a different area where they were a little naive, you know, not as well experienced, not as well articulate, they might not be able to deal with the process of calling the number, getting your right zip code, getting the right agencies, and asking for what they need.